Learn Chiropractic, Part 6, Treatment Approach.
Treatment approach not only depends on the condition being treated, but also the chiropractor's technique or specialty, of which there are several. Acute conditions, which are those involving a recent injury or aggravation of a pre-existing condition where there is swelling, heat, redness, and acute pain, are typically treated with pain-relieving modalities, light force adjustments, and joint mobilization. Conditions that are further along can be treated with firmer adjustments, more aggressive soft tissue therapy, and spinal traction. The goal of chiropractic treatment is to reduce subluxations, also called fixations, to improve alignment, reduce pain and discomfort, and reduce any spinal irritation to nerves. Besides classic osseous adjusting, which is taught in this course, there are also upper cervical techniques which focus solely on the C1, C2 vertebra, techniques that involve using a type of handheld instrument that delivers a short, quick impulse to the vertebra, techniques that emphasize posture correction and curve correction, and several others. Despite the different styles, they all have this same goal. Modalities support adjustments by reducing pain and relaxing muscles and can be applied before and or after the adjustment. They include heat, cold, vibratory, and electrical stimulation applications. The vast majority of people who visit chiropractors report that their condition gradually appeared, such as lower back pain, versus a condition in which they had a recent accident or injury. The reason for this is that, like a developing cavity, it takes time for the effects of a subluxation to be felt. Typically, the patient feels discomfort in an area, such as the shoulder, for several weeks to several months and is able to bear it. They are able to carry on with their lives with this discomfort in the background. Then, as the subluxation further irritates surrounding soft tissues and nerves, the discomfort turns into pain and the patient calls the chiropractor. By this time, muscles and ligaments that surround the vertebra have shortened and hardened or calcified somewhat. As a result, although one spinal adjustment can free up a subluxated or fixated vertebrae instantly, those contracted, hardened soft tissues pull the vertebra back into its distorted position after a day or two. This is why a typical chiropractic treatment plan calls for multiple treatments in sequence over a period of time. For example, 6 treatments at twice a week for 3 weeks, followed by a reevaluation. It is also why home exercises and stretches are prescribed. Like braces that are used to straighten teeth over time, it requires multiple applications of forces over time to restore a misaligned vertebrae to its proper position and have it maintain that normal position. Improvement from chiropractic treatment can come in the form of decreased pain intensity, decreased frequency of pain, a shrinking of the area of pain, for example, buttock pain radiating down to the leg and calf now is only present in the buttock, improved range of motion, and improved strength. It can also be measured by improved activities of daily living, such as better sleep, less headaches, more energy, and the ability to sit or stand for longer periods without feeling pain. If a case is going to improve with chiropractic treatment, and not all of them do, symptoms will noticeably improve within the first 6 treatments. If no appreciable improvement is observed within the first 6 treatments, then the patient is referred out to another specialist. At the conclusion of a chiropractic treatment plan, the patient will either reach a pre-injury status or what we call maximum medical improvement with or without residual symptoms. At this point, the chiropractor may suggest to his or her patient periodic, ongoing spinal adjustments called maintenance care to maintain this level of correction, as there is potential for the subluxations to return due to the rigors of daily living. A maintenance care program depends on the condition of the spine and the general health of the patient. For example, a 50-year-old ex-football player is going to have a much different looking spine than a 25-year-old healthy male who is active. Maintenance care may involve weekly, monthly, or quarterly spinal adjustments. Just as ongoing regular exercise helps maintain health and fitness, regular chiropractic adjustments helps to maintain the health of your spine and reduce the risk of developing problems in later years.